Thank you, Carla. I'm not sure I can do both hands at the same time, but we'll find out. I'm Bill from United Healthcare, and we're delighted to be partnering with Kentucky State and with Nice Lukens again to provide health coverage for Kentucky State employees and the faculty for the coming year. So we're delighted to still be here, and we hope this to be a long-term relationship where we can bring real value to you through the health plan. I'm going to talk about a few things. The most important thing I think we're going to talk about is the Simply Engage Wellness Program. This is a program you've had for ever since United Healthcare's been here. It's an option that the university elects to provide for you, and it's a wellness program. And real quick, the first thing we should maybe mention is do we even want to focus on wellness? And as you can see, there's a lot of reasons to think about taking care of yourself. A lot of folks have high blood pressure and don't even know it. There's some bad things that can happen from not knowing. There's no symptoms. There's the only way to find out what your blood pressure is to have a trained professional check it for you. It can lead to things like strokes, heart disease, kidney failure, if left untreated for a long time. But if you know you have it, it's usually pretty easy to control in working with your primary care physician. So that's a good reason. Chronic diseases account for about 70% of our total healthcare spending. Now stop and think about that for a minute. The choices that we make as individuals every day, what we eat, what we drink, what we smoke, for those that do, how we, live our lives, accounts for about 70% of healthcare spending. And of course, most of the money that is paid in premiums by you out of your paycheck plus what the university contributes ends up paying your healthcare claims. So one reason we're kind of trying to focus on wellness is maybe we can live a little bit healthier lives and take a little chunk out of that 70% and help all of us in the future keep that spending trend down. Also, heart disease is the number one killer. Getting your wellness helps you keep track of that. Tobacco use, if you've been conscious the last 10 years, I think you should be well aware of the toll that tobacco use takes on us. And then, of course, obesity and people being overweight is really becoming a major health issue in the United States. So these are all things to be aware of. It's good reasons to do wellness. So let's talk a little bit about what you can do with the university's program, Simply Engage. There are 3 things that you can do to actually earn rewards. So not only might you learn a little bit about your health, we got a little carrot for you too. You can earn, if you do your health assessment, a $75 gift card. If you do an online health coaching session, $25 gift card. And if you want to do a more involved telephonic health coaching session, you can earn a $75 gift card. You can actually do all 3 and earn up to $175. That would go a long way towards helping somebody do Christmas shopping. If your spouse is on the plan, they would have to be on the plan, they can also do these 3 activities and earn up to $175. So something to think about. The health assessment is an easy one. We're going to talk about each of these real quick. Of course, it helps in order to do your assessment if you know what your numbers are, what your blood pressure is, what your cholesterol, those kind of things. You get a much better result from your health assessment and more accurate. So we are going to work with the university to try and schedule a screening event here at the university where we will bring people in and they'll do these 4 things. Take your blood pressure, they'll do a non-fasting cholesterol test so you don't have to worry about not eating all day, glucose, and the BMI. So that'll give you some basic numbers. And that's free to you. All you need to do is schedule your appointment, show up at your right time, and we'll take care of you. So hopefully we'll get that scheduled in the fall when everybody's back. Once you get your numbers, that's a good time for you to go out and take your health assessment. That's how you get a good results from your assessment. It only takes about 15 or 20 minutes. It's 50 questions long. You access it through myuhc.com. If you have your numbers, it makes it better. As soon as you're finished, you can claim your reward right on the website, and we'll show you that in just a second. But you get your $75 card. So that's a great thing. If you don't want to wait for the Know Your Numbers event this fall, don't forget you have preventive care benefits built into your plan. You can go see your primary care physician, have your annual physical at no cost to you. And you can check out uhcpreventivecare.com to see, put your age, your gender in, and it will tell you what tests and screenings are appropriate for you. So, but once you finish, you're going to get a personal results report right there online. And if you want, you can enroll in some of our coaching programs, and they can either do the online or telephone-based coaching. So the health coaching programs of MyUHC helps you reach your goals. This is talking about the online sessions, and you can see there are diabetes, exercise, heart health, nutrition, smoking cessation, stress, and weight loss. I think there might even be a couple of new ones out there. I have to check. But what you do is you email your coach back and forth through the website over a 5-week period, where you'll have activities to do, you'll have, if you're trying to exercise or eat better, you'll keep track of what you're doing, report your results to your coach, and your coach will give you some feedback and encouragement. It's no cost to you to participate in the coaching program. If you get through the whole 5 weeks and finish it, you can claim another $25 reward. The telephonic coaching is a little more intense. They are 10 to 12-week sessions, so it takes longer. You're going to spend a little more time and effort on telephonic, but hopefully you'll get more information and more results and be a little further down the path of getting well. It's the same categories, but you actually have a telephone call scheduled with your health coach each week. So you have that direct one-on-one feedback from your health coach. Some people work better that way than waiting a couple of days to get a message back on an email. If you finish the telephone health-based coaching, you can claim another $75 reward, so you can do all three. You'll get a confirmation email letting you know how to redeem your reward, which you do online. There's over 350 retailers, restaurants, all kinds of places. There's no way you're not going to find something you want to claim a gift card for. So lots of choices there once you've earned your rewards. Do note, incentives can be earned only once every 365 days. Some of you have probably done your health assessment this past year, so you do have to wait till 365 days are up, but then, keep track and you can do it again. And you can check online, I think, to see when that is. And there's a telephone number if there's a question about your rewards, and that number is we do have a Simply Engaged flyer in the packets that we have next door, so if you want to pick one up, you'll have that info there. So the Simply Engaged screening, health assessment, coaching, great tools to kind of get you thinking about your health, doing some things, taking some steps to be healthier. So we talked about the health assessment. You have a personal health record online on MyUHC that kind of keeps track of some of your numbers, where you can put like your blood pressure or your cholesterol and track it over time. If LabCorp does your lab work, they will actually put your results for certain tests out there, and you can track it over time to see if you're getting better. Lots of wellness tools and trackers. We'll show you a couple of examples of that in a minute. Don't forget you have the 24-hour nurse line. The nurse is a great resource for questions about medications, locating the best provider. If you've got some medical services that you need, they can help point you to some of our 2-star docs. They can answer medication questions. If you're going to see a specialist for the first time, they can help you get ready to go see the doc by telling you, here's a list of questions you and your doctor need to talk about. So great resource. Don't forget to have them. And the premium program is out there too. You've done a search for providers on MyUHC. We bring up the 2-star docs first. And by 2 stars are the top of the crop for our premium designation program. We have 21 specialties that we rate. We don't rate them all, but all the primary care are rated. But if your provider or our network providers are using evidence-based medicine, which means they're following the guidelines like from their own professional societies, it's their criteria, not ours, then they can earn 1 star for quality. So they're doing the things that all their peers say you should be doing for this particular medical condition. If they are also cost efficient in providing that medical care, which means they don't have a lot of redos, they don't do unnecessary tests, they don't send you places you don't need to go, they can earn a 2nd star. So when you do a search, bring up the 2-star docs first, but I always, if I'm getting sent somewhere, I look to make sure my primary care is still a 2-star doc, and he is. And I encourage you to utilize the 2-star docs when you can. Studies have shown that our 2-star docs do save money Over time, their episodes of care tend to be about $1,500 to $1,700 cheaper than the non-premium designated physician. So some more incentive to use them. Here's just a couple of examples of some of the tools you can see online. The scary one there, the fast food calories is, I don't know, that might scare you away, but the food pyramid, BMI tool, little video there that, you know, hey, I'm going to get started to get exercise. And there's also lots of recipes, tools, and trackers. You know, if you're going to start walking or whatever, you keep track. You're going to start journaling what you eat to try and eat better. You know, you get those kind of tools out there too. So do take a look. Lots of things to pick from. When you do go to claim your dollars in your health dollars section of my UHC, you know, you can see the first tab will show you what you have already earned. So if you've earned some rewards, you can look in there and see and figure out how long you have to wait before you can do it again. In the second tab, it shows you what incentives are available to you. So it should show you can get a reward for doing a health assessment, a reward for online coaching, or a reward for telephonic coaching. And then the third tab will show you information on redeeming your rewards. So it's all out there online through my UHC. If you haven't been out there lately, you know, go out and take a look. Okay, so wellness, you know, that's going to be the new mantra, and we've got some tools that KSU and United Healthcare are putting together to help you go down that path. We've also developed a couple of new tools over the last year or so, and one of them is our Health for Me app. If you have a smartphone, you can download this, either Android or iPhone, for free. There's no charge to get the app. You do have to have your myuhc.com account activated because it's your same user ID and log on. But you can do about 70% of the stuff you can do online on myUHC, you can do on your phone. And we're going to show you just a very short video, it's less than 2 minutes, that highlights some of the features of the Health for Me app. So hold on. Thank you. I thought maybe it was too long in this description. Okay. Yeah. So if you've got a smartphone, and I finally broke down and got a smartphone. Unfortunately, my smartphone's still looking for a smart user, but you know, slowly but surely we're getting there. But it's a great, you know, you got stuff with you. You got your ID card right there. If you're in Florida on vacation and you know you get sick or the kid gets sick and you need to find urgent care or convenience care, just do a quick search and it'll show you based on your location those providers. So it can also get you to the treatment cost estimator. And the treatment cost estimator has really been, we've had one for a couple of years, but we've really jazzed it up over the last 6 to 8 months to where it drills down to our actual network provider contracts in most areas of the country and in most of Kentucky. So you can actually go shopping through the health cost estimator and find both quality ratings and the price of a procedure. We have currently about 120 procedures. It's mostly like outpatient surgery things or MRIs, CAT scans, but you can actually see what it's going to cost you. And you'd be surprised at how big a difference there is in cost between providers, even though this hospital's in the network and this hospital's in the network, the costs are a little bit, can be, hundreds of dollars difference. So if you got deductibles, which everybody does, maybe you can help save a few bucks. So we're going to show you another just really brief, it's less than 2 minutes, video that highlights the features of the new treatment cost estimator.
Now you can take charge and know more with United Healthcare's My Healthcare Cost Estimator, an innovative online tool that gives you easy access to more personalized healthcare options. Get estimated prices for treatments and procedures, and compare providers with side-by-side quality information before ever setting foot in a doctor's office or treatment facility. Everything you need to control costs, compare services, and anticipate future expenses is right at your fingertips. It's quick and easy to find a safe, affordable path to quality care that's just right for your life, your budget, and most of all, your health. It's all about getting to know the 4 P's: procedure, provider, price, and place. Here's how it works. The homepage makes it easy to find your recommended procedure. Just type in the first few letters of the treatment or condition and click search. Each page features the See My Benefits button, so you can always check your deductible and see an overall view of your plan. It's important to note that at any point while using My Healthcare Cost Estimator, you can call United Healthcare's customer care professionals, who will gladly help explain and guide you through the tool and your estimate. Now you can get a 360-degree understanding of a procedure and learn about other options that may provide a similar result. In this case, an X-ray. Helpful information about preparation, risks, and benefits, plus tips on what to discuss with your doctor, are listed below each procedure. The online tool displays options for this service based on estimated costs, type of treatment center, and approximate distance from your home or office. Compare estimated costs at each treatment center, which are color-coded in red if it's above the average local cost, or green if below. See how much of the cost is covered by your health benefits and any out-of-pocket costs you may be responsible for. Then use a map to easily find the facility and get driving directions. Other helpful information at the top of the screen includes your deductible, out-of-pocket maximum, and, if available with your plan, your health savings account balance, which you can use to help cover costs. To complete the estimate, click on the facility you'd like to use. In this example, the cost estimate for your knee MRI at Central Hospital is $465, which is lower than the local average. Your employer-sponsored benefit plan will pay $212, and your out-of-pocket cost will be $253. There's a list of common reasons why the actual cost could differ from this estimate, as well as a list of items you can discuss with your doctor to help avoid those situations. In addition, you can see how the $253 cost estimate breaks down: $200 toward the deductible and $53 for co-insurance. Your health benefits will cover the rest. Now that you understand the cost of a knee MRI at Central Hospital and approximately how much to budget for the procedure, you're ready to talk with your doctor. My Healthcare Cost Estimator helps you understand and manage your healthcare costs like never before. With helpful tools and support, this next-generation cost estimator brings critical cost and quality information to you in seconds, giving you smart, cost-effective paths to great health. Through the power of innovative thinking, United Healthcare empowers you with the resources you need to be more in control of your healthcare.
It's a great tool, takes you right to the contractor rate. So I would encourage you to use it, and you can get to it through the Health for Me app. So if you're in the doctor's office, he's trying to send you for an MRI, pull your phone out and go shopping before you get that referral. Okay, a couple of great tools that we've shown you. One last thing I want to mention real quick is United Healthcare is changing our pharmacy benefit manager for Kentucky State University, actually for all of our customers in the central region on June the 1st. We've been using Medco Health, and we're going to move from Medco Health to Optum Rx. Optum Rx is a company, a pharmacy benefit manager that is owned by United Health Group. They have been in the pharmacy management business for years. They were a part of Pacific Care before United Healthcare acquired them. They've been doing this for years. They are actually the largest Part D, Medicare Part D pharmacy benefit manager in the country. So for them, it's just a matter of scaling up to absorb the increased United Healthcare folks. And we're doing it in stages. We started January 1st, April 1st, and we're actually going to be in the third wave on June 1st. So being third, that's kind of good because they've got all the wrinkles out before we flip the switch. But it's been a very smooth transition. There's been very few issues. So everybody about the 1st of May is going to get a letter telling them about the switch over to Optum Rx on June 1st. Going to have an FAQ document in there to answer any questions that you have. About 10 days later, everybody's going to get a new ID card. Okay, we have to issue new ID cards because on the front of your card, there's a little box for the pharmacy. It's got a BIN number and a PCN number, and that's how they enter your pharmacy claim into the system to get reimbursed. So starting June 1st, make sure you're showing the drugstores your new ID card so that they put that in right. We're working with the drugstores. You know, they know this change is coming, and they've been educated, but it would be most helpful if you had your ID with you. The co-pays, you know, what's covered, what's in what tier, none of that is changing. United Healthcare has always managed that process. We've always told Medco where to put drugs, so we've always managed what's on the list and where it goes. So your benefit's not changing, nothing like that's changing. There are a few little changes though. You know, if you've been using, most of the drugstores that were in Medco's network are in the new network. There's going to be very few that aren't, but if by some chance you've gone to some little mom and pop drugstore that you use that didn't sign a contract with Optum, you'll get a letter explaining that to you and where you can go and stay in network. Mail order is going to be a little bit different. Most of the prescriptions are going to transfer over for those of you that use mail order, except for things that have opiates in them, which we cannot do by law. So if there's an issue with that, you will get a letter explaining that to you. If you're paying by credit card, we will not transfer credit card information from Medco to Optum Rx. So if you're on mail order, you will actually get a welcome call before your next fill is done, and they'll explain all that to you. But it's also going to be on your FAQ, so keep that in mind. Main thing is get that new ID card, take it to the drugstore for any script after June 1st. I'm sure it's going to be a smooth transition. So with that, I thank you for your attention for United Healthcare, and I'm going to turn it back over to Carla for dental.